Thank you very much, Dr. Lambrou. So where we started is where I'd like to pick up now. Donald Trump talked about the concepts of a health care plan. We've been talking about the specific gains that patients like Ms. Aiken have made this year. And this committee has actually seen the consequences of Donald Trump's inaction. For example, in 2019, we passed out of this committee, I think my friend Senator Cassidy remembers this, we passed strong cost containment legislation out of this committee. Senator Grassley and I led that effort. Senator Cassidy, very supportive of this effort as well. It contained the price gouging penalty. And Senator Grassley pulled out all the stops to get then President Trump to be supportive of that effort, and President Trump wouldn't do it. So the consequences of inaction are real, and this committee has seen it, because we could have had that earlier and would have had something that would have been of benefit to so many patients. Now, Ms. Aiken, if I can start with you, we had a lot of numbers being thrown around here. It's pretty much root canal work comparing everybody's numbers. But it looks to me that you're paying now thousands of dollars a year for this arthritis medicine, Enbrel. And it looks to me like you have already saved 2/3 of your out-of-pocket expenses. Is that right?
That's correct.
Okay. What happens if most of this law goes away? You know, because we're all talking about this part and that part and all the rest. But these provisions, as I say, some of them came from this committee in 1990. What happens if most of this goes away?
Frankly, I'm scared to death of that. We tighten our belts even more. And don't do things, you know, may have to, I can't even think of where we would be. It would be very, very difficult.
So you're counting on having some certainty from the Congress to keep building on what we're doing rather than unraveling it.
I didn't catch the last part.
No, you're counting on the Congress building on the progress we've made, not getting rid of the law.
Correct.
Okay. Now, a question for you, Dr. Lambrou, if I might. J.D. Vance talked over the weekend about some health insurance jargon, and basically he's talking about changing risk pools. And it looks to me like he, presumably Donald Trump, want to strip out consumer protections by separating out sick and healthy people. This looks to me like what amounts to a de facto repeal of the protections that everybody says they're for around here. Protections for people from being discriminated against if they have a pre-existing condition. What would happen to health insurance for Americans if this Vance scheme went into effect?
Thank you, Senator Wyden. We know from experience that having separate risk pools often leads people with pre-existing conditions to pay higher premiums for health insurance, often being priced out of that coverage altogether. What that means for a person with cancer, they can't get their chemotherapy. A person with diabetes struggles to pay for dialysis. And we've seen this story before. People will not get needed care, they will experience worse health, and they could prematurely die. We also know, though, that separate risk pools may seem like a good deal for somebody who is young or healthy, but when they have an accident or an unexpected illness, those plans often don't cover the care that they need, leaving them worse off. I think, Senator, you're right that this policy of separate risk pools, coupled with not extending the Inflation Reduction Act tax credits, would significantly undermine the risk pool, raise premiums, cause more people to become uninsured, cause more hospitals to struggle to pay for that uncompensated care, and effectively repeal the Affordable Care Act. I think you jump-started my next question about keeping those, premium
tax credits. That was something I felt very strongly about. A lot of my colleagues talk about it, protecting working families through the private sector. That's really what these tax credits are all about. This is not some Washington, D.C. Goliath. This is about tax credits in the private sector for working families. How much more are families going to have to pay if this thing goes away? Because it comes up pretty quickly.
Sure. Well, I think we know that for families with income or individuals with income between $29,000 and $45,000, their premiums will double. We know that those premiums will increase even more for lower income people, and for people with higher income who are newly eligible for these tax credits under the Inflation Reduction Act, they'll lose that assistance altogether. That's why CBO estimates that 7 million people will lose marketplace coverage and 4 million people will become uninsured altogether.
So we're talking about 11 million people who would be hurt by letting these premium tax credits vanish into the vapor.
According to CBO, there's again 7 million more people in the marketplace because of these credits that will go away without them, and 4 million people of the 21 million now covered would lose coverage. I should just mention, it's not just families, Senator, it's also small business owners and entrepreneurs.
Okay. Senator Crapo.
Thank you, Mr. Chairman. I want to pick up on the same concept that the chairman was just talking about.